Verla, welcome. Welcome to our show.
Thank you.
Have you ever been or seen our YouTube channel?
No.
Been on? Okay. We make videos of interesting clinical cases, and we've never done one on pink eyes. I'm not going to call it pink eye until we confirm it. And red eyes can be allergies, they can be just viral conjunctivitis, they can be bad viral infections, and we're going to look at yours.
Okay.
So which eye?
It's in both of them. It started in my left, and then the next morning, it was in both of them.
Okay.
And when this one started, it was just a little bit of crust, you know, but by Sunday it was...
Does it itch?
Some.
Does it hurt?
It burns.
Burns.
The right
Okay.
one burns.
And nothing got in your eye or...
No. My two grandkids had it.
Oh, okay. So we're
Yes.
thinking something contagious, most likely.
Yes.
The reason we asked you to come in was because we really wanted to check. I had the impression it was one eye,
Oh.
but we do want to check the eyes with a stain to make sure there's not any kind of bad viral infection. And specifically, that viral infection we're looking for is the herpes virus that can cause so many different problems in different parts of the body. Even chicken pox and shingles are a herpes virus. And it can occur on eyes and be misdiagnosed as pink eye and actually damage people's corneas. So especially when it's one eye, we really want to get a stain on to make sure it's not that. And in your case, we'll check both eyes. Put a little bit of stain in there. So this is fluorescein. It looks orange, and when it gets in your eye, it turns things kind of yellowish. Actually, your eye is already turning kind of yellow. You may even notice it. And then we're going to get some and put it in your other eye. And see, there's very little sensation here.
Yeah.
If I put it on the cornea, it makes people blink. And there, yeah, you can see the color change. So that color change is going to be a big deal in a moment.
Pretty good.
Okay, and I'm going to look too.
Let me take a look.
So what I'm seeing is the yellow is definitely in your eyes. I'm not seeing any at all on your cornea. The clear portion, let me have you hold that again, that covers over the iris and the pupil does not have any uptake at all, showing us that there's not an injury to your cornea. Things that'll show up and glow with that yellow are those viral infections, and if you have injury to the cornea, like a scratch, or if a piece of metal, you know, like people grinding, gets in the eye, it'll glow on that. Again, I want to confirm no colored discharge from it.
Okay.
Just crust, that's all you've had?
Yeah, just solid. Well, it's like this yellow crap.
Is it like creamy, pussy?
Yeah.
Oh, it
like,
is?
Yeah.
Okay.
It's like this morning when I pried it open, my eyelashes were all covered with stuff.
Okay.
And down
it's creamy
in
stuff?
the eye, yeah.
Okay,
There was
then
the
we do
yellow
want to
pinky
use,
stuff.
and we have the choice of either
yellow
drops.
stuff.
Yeah, so that sounds like a bacterial infection if you actually have the pus produced. We have the choice of either ointment or drops. I'm a fan of the ointment because it's somewhat soothing to the eye. You have to pull down the lower eyelid and actually put a little ribbon of the ointment in the eyelid, close the eyelid and pull the tube away, otherwise it just comes out with it. Or you can use drops, but the drops kind of sting when they go in, and I feel like they're harder to get in the eye than the ointment. Do you have a preference? Well, let's do the ointment then.
Okay.
Okay, so we'll send that to your pharmacy, and we'll have you use that for 5 days, which should be more than adequate to chase it away.
Okay.
All right.
Wonderful.
Hey.
Thank you.
Oh, thank you. Thanks for participating. Thanks for joining us. And we also want to say a special thank you to BooBoo Kitty and Lindsay Antoine, who helped to actually make some of this possible. They're on Patreon, and those on Patreon can actually see some videos we don't put on the regular ones. These people help to make it happen, so we give them special access to videos we make in the office. Thanks again, Verla.
Great. Thank you.
Until next time, Verla, myself, Dr. Mark Vaughan, telling you to stay in good health.